Welcome to another session of Back to Basics, guys. Welcome to Natural Gut Relief. My name is Dr. Vivian Asamoah, and we have the utmost pleasure of having a special guest with us tonight today, and that is Dr. Heidi Kussman. Heidi, it is wonderful to have you here.
Thank you. It's a pleasure to be here.
Thank you for joining us. I want to tell you guys a little bit about Heidi's background and why I thought it was instrumental to get her on our live tonight to really talk about the topic that we've been discussing this week, which is arm yourself against cancer. So I'm going to just let you guys hear a little bit about her bio, and then I'll let Heidi actually do her own introduction. So Dr. Heidi Kussman is a licensed naturopathic doctor and has been in good standing to practice since 2002. She moved from Houston, Texas in June 2021 to Abu Dhabi due to spouse relocation. She is board certified, fellow of the American Board of Naturopathic Oncology, and internationally licensed in Canada and the USA. Dr. Kussman has over 20 years of experience in integrative oncology. We are honored to have you on board, and I'm really excited about this conversation. Heidi, tell us a little bit about yourself and your journey.
Well, first, I want to say thank you for having me. It's lovely to speak with you and to be able to help your audience learn more about things they can do in terms of arming themselves against cancer. My journey in oncology started when I was in clinical practice in my earlier years as a new grad, and I was attending continuing education seminars and the usual things. And there was a course on genomics and epigenetics that I had taken. And one of the main drivers and one of the oldest well-known epigenetic signaling markers is the P53 gene. And at that time, this is going back now 18, 20 years, they were talking about its ability as a tumor suppressor gene, and that when methylated doesn't suppress tumors, it actually promotes them. And it's like a switch. And so I was like, oh my goodness, this happens. And then where else does it happen? Like all of these thoughts just started cascading in terms of, if this happens here, then it can't just be one cell or one part. And so my passion for oncology and blocking those pathways started back then. And it came from my training as a naturopathic doctor as well, because everything that we do is taught about finding the cause, learn the mechanisms of how the inflammation or the illness, the process of dysfunction, how does that start? Understand that biochemistry and physiology and the signaling pathways involved, and then use your tools to stop it or to adjust it or to influence it in a way that promotes healing. And so a lot of it really fit with my philosophy as a naturopathic doctor, and then learning about this switch process with oncology, it started for me, and then it went from there into becoming certified in oncology and treating people who have cancer. So that's sort of my journey, and something that I think is lifelong, because oncology is always changing and there's always more information, and there's boatloads of research to always sift through and translate into normal, understandable language for patients so that they can help, they can understand how to help themselves and make the best decisions for their treatment or for
Right.
as well.
I think it's really interesting that you say that, because I don't believe that in conventional medicine, we think about cancer that way. I think as a naturopathic physician, you're thinking about, okay, what are the cell signaling pathways? How can we block this? And then even when it does happen, what can we do to, promote treatment, right? Improve our outcomes, improve treatment. And
Yeah.
I don't think that's something that we really taught to do in conventional medicines in terms of prevention, other than doing the testing to find cancer early and then stop cancer, right?
Well, and there's, originally there's two different types of theories of how cancer develops, and conventional oncology has adopted one and based all of their treatment and research on that one theory. And that's where you ended up with things like cytotoxic therapies in the beginning, because they assumed it was I don't want to I don't want to belittle naturopath or regular conventional oncology, because they have tough battle, and they're the ones that do a lot of the work with patients. A lot of my work is supportive. But when they started out believing that cytotoxic therapies were the only way to go, it is a lot of the other options of theories of what could be perhaps studied in tandem or in parallel and as an added strength. It's only now that inclusivity is starting with the different types of theories, and you're seeing it because we're moving from cytotoxic therapies to targetable therapies and immunotherapies. And this is something naturopathic medicine has been doing from a naturopathic perspective for 20 years. We've been targeting and immune supporting or, adjusting immune pathways to shut down inflammation and promote healing, because that's been what we've been taught and told what to do.
Right. And word there, so it's that inflammation driving that immune dysfunction, right?
Yeah. And so it's nice. I'm at a point in my career where I feel we can link hands with conventional oncologists and move this needle towards helping people in a way that hasn't really been thought of before. We can now do comparative and efficacy studies together. We can now bring forward the things that are needed for whole person care, So I'm really happy to be at this stage.
I think it's an exciting time in oncology in general, just to see the evolution in terms of the research that's coming out and treatment response based on how we modulate inflammation, change the gut microbiome in the system. So, but let's go back to basics, because you're already getting really deep, Heidi. You're getting really deep. Let's go back to the basics. So for the person like myself, who really does not have a ton of experience in integrative oncology, and I'm really glad to have you on today, what kind of modifiable lifestyle factors, when we talk about that topic, that title of Arm Yourself Against Cancer, we're now talking about what can you do to prevent some of this? And is this even possible? What would you say?
I would say that it is possible if you are someone with high risk in terms of family history or genetic predisposition towards developing cancer. Then your ability to prevent it might be less. You will be able to delay it, though. You will be able to do a number of implementation from a preventative standpoint that can prevent and then, or if not prevent, delay the onset of cancer by years. I think that is a strong argument for the preventative side when it comes to inheritable disease. And not just cancer, but in a lot of different inheritable diseases. And the research is showing that, there's different levels and triggers that start something from early stages and go up to chronicity. And so part of it is being able to modify along that path in that timeline, so that using your diet, for example, as a major source of an anti-inflammatory aspect in the immune system is key. So when it comes to preventable stuff, I talk about kind of like a foundational support of habits, if you will. Okay. And I think this is where the division of lifestyle medicine has come in. But your dietary approach to your health is kind of like the quality of the gas you put in your tank. And if you're not using things that are low pesticide, low exposure type products that your family consumes, you may want to consider doing that first. Look at where your sources of exposure are. Use the environmentalworkinggroup.org. Their website is a wealth of information on how to start with your own consumption of products in terms of food, in terms of personal care products.
Personal care.
It has a rating system, and they have a number of guidelines, and it's all backed by evidence in terms of the Clean 13 foods. If you can't eat organic, you need to eat these Clean 13 foods, that sort of process. And so they're very consumer friendly advice that during this time of inflation and all of the trouble, this is still a resource that's viable for people. People often think of organic or other types of dietary changes expensive. And this isn't the case anymore, and that you can find foods that are highly nutritious, that are not expensive, that don't cause more inflammation. Mm-hmm. So, and the reason we bring up food is because over the lifetime of an individual, it has been shown that when you eat healthy, in addition to other lifestyle factors I'll get into, but when you start with diet alone, your mitigation of disease and the expense that you incur as a result of that is a big deal. It has a big impact on your overall quality of life and your longevity. So it goes to say that if you're thinking of your family and your children, and if you have, for example, any type of heritable diseases, including cancer, that might be genetically linked, like the BRCA1 and 2 mutations or other ones, APC, all of those types of things that come up, then you may want to look at how children's metabolism is further influenced by things like pesticides, because their body mass is smaller.
Absolutely.
It's simply a matter of concentration up the food chain with a smaller body mass, creating more damage.
Bioaccumulation
at an earlier age.
Time, right? Yeah.
Yeah.
Mm-hmm.
And so there's different theories about how cells replicate and the number, that a cell will replicate before it goes off and becomes abnormal or dysplastic. But the end result is you want to minimize as much bad cell changes as possible by giving your DNA the proper fuel. Really, it comes down to that. What you eat becomes a part of your cellular structure. And if your cellular structure is unhealthy, you need to change what you are exposing it to.
I really like that. What you eat becomes a part of your cellular structure, to a point all the way to your DNA, and how that can change and now start causing dysplasia and then leading to cancer. So this is really important. First point. And second point, this starts really early on. And actually, the younger your kids are, right, the longer the exposure, the longer the exposure of these pesticides that we know definitely have these carcinogenic properties, the higher the chance of them developing something, decades later.
And so our environment plays a role, what we eat plays a role, but now we're realizing our genetics don't play as much a role. It's the environment. And you'll see, and you've probably read, the number of pesticides in our foods and in our children has gone up and is higher at higher levels than what it was decades ago. And this is primarily, I believe, this is the reason why we have cancer happening in people at younger ages.
Right.
That's the reason. I don't think it's all pesticides. I think there's a multitude of factors. It's a multi-causal issue.
Right.
But things we can influence are the diet. The other thing that actually improves longevity across all diseases is exercise. Mm-hmm. And for my patients who are in maintenance or watch and wait or remission, I joke with them about it, but I'm like, your exercise is your chemo prevention. You need to think of it as that equation. That when you do those 2 high intensity intermittent workouts per week, and the other being at least 30 minutes of aerobic activity, you are creating the level of molecular balance that's needed for your cancer to be held in check and to keep it as a chronic disease, rather than something that is like a raging sort of inferno causing inflammation in your system that your system can't manage.
So let's go back to the exercise quantity, right? It seems like there's scientific data supporting this, right? So how much high intensity, what can you give us examples of what?
The high intensity, and if someone is cleared for exercise and they don't have mobility troubles, they're not post-surgery, all of those things need to be monitored. But if you're going into surgery, you're healthy, or you're recovering from and you've been cleared to exercise after surgery or chemo or radiation, then the things that you want to maintain has to do with a certain intensity. So you need a minimum of 20 minutes of high intensity interval workout twice per week in order to gain the benefit. I'm not talking weight loss. Right. I'm talking about keeping your muscle mass and maintaining your levels of there's molecules that you can measure, like interleukin-6 and CRP and the different inflammatory levels that directly correlate with the level of inflammation as well as muscle mass loss. And there's studies that show that when you can maintain your muscle mass through chemotherapy, through your diagnosis, well into afterwards, through exercise and resistance training, the high intensity stuff, it's not fun. I think I'm dying when I do it, but I do it and I get through it. And really, I give it as, this is what I'm doing to control the process in me that caused my cancer, now 2.5 years ago almost. And so for me as a cancer survivor, it's also part of my regimen. So I also do what I tell my patients to do. At least I try. Some days are better than others. We're only human after all. But those 2 high intensity workouts per week, and then a minimum of 30, better to get 45, because you want to get into that sort of that fat burning aerobic activity where your heart rate is in, 70% of your maximum heart rate. And so there's different equations to figure out your max heart rate. I would clear it with physical therapy first. If you're unsure, if you've never done exercise like high intensity weights or resistance or high intensity aerobic activity, then you need to get some clearance first and assess if you have muscle imbalances or any other, your fracture risk, with bone metastases. There's important things to consider that you may not be able to do.
You need clearance before you engage in these impacts. Now, for the average person who's trying to just arm themselves, just incorporate the exercise into the lifestyle.
I would recommend that you do a variety. They do recommend, the general recommendations are 150 minutes per week of aerobic activity. And so if you can aim for 5 30-minute sessions a week, that works. It could be walking. They talk about how you can get, 10,000 steps.
Right.
And we're walking at a good pace. We're not sort of at the mall.
We're not on our phones.
No, we're not texting.
No. Okay, so
that doesn't count.
It doesn't count. We've talked about diet. We've talked about exercise. What else in terms of modifiable risk factors?
The other big is sleep. In that there have been a lot of studies that show night shift and third shift workers are more immune compromised or immune suppressed, and their risk of cancer is increased as a result. That's an environmental effect. That's not genetic. And so when it comes to those types of things, if you can work on getting the right amount of sleep, then you want to have, and there's a ton of monitors and wearable devices that will monitor your sleep for you and give you feedback. Please don't be discouraged if you find in the first time of wearing those things that you're not actually getting the REM sleep you need or the deep sleep. They say you need about 90 minutes of deep sleep every night. You're only getting 30. Well, it's your baseline. You can use it as feedback to gain further understanding on how you can modify that. And there's some good books out there. There's great resources that will help you. If you have sleep apnea, your risk of developing other diseases actually goes way up as well. And so sleep apnea is something that is an inflammatory event that affects our ability to get oxygen. And in a hypoxic environment, cancer cells work really well. And so if you even have circulating cancer cells, you want to be able to starve them of any opportunity for growth. And sleep apnea does not do that. And so you have to fix those things in order to develop a good sleep hygiene or a good sleep habit.
It's incredible how sleep apnea affects, it's like it's a whole systemic, effect in the entire body from, of course, cardiac issues, high blood pressure, association with insulin resistance, acid reflux for my patients, erectile dysfunction, and now hearing that, it can even impact, your diagnosis or your prognosis if you do have a cancer, right?
Yes.
Wow.
The other modifiable things have to do with the rising prevalence of lifestyle-based diseases. So in the gut, things like diabetes, the just being off in terms of not functioning properly, those are all contributors to chronic illness. And they set the inflammatory cascade towards abnormal cell function and disrepair. If you have genetic predisposition to cancer, that might be all you need to creating a cancer condition. And so, again, I don't want to scare people into doing these things. I want them to realize they have tools that they can employ. They're hope, and it is entirely possible. I'm walking proof of it. In that, with my cancer diagnosis before that time, I was healthy. I was a naturopathic doctor doing what I tell my patients to do. being as healthy as I could, exercising regularly, eating organic, eating well. But I was pre-diabetic, and I didn't realize how sensitive my body was. And I'll speak a bit of my personal experience, how sensitive my body was to the changes that a pre-diabetes condition creates. In that prior to my diagnosis, I had gained weight. And for me, I had only gained about 7 pounds, but it was enough that I was like, something's not right.
Right.
We'll talk about screening for colon cancer in a moment, because I have to, from the story, I can understand what people are talking in terms of whether to get a colonoscopy or employ other options. But for me, I knew something was off. And my A1C level was only 5.2%.
Mm-hmm.
So
which
nobody
would be considered as pre-diabetic.
Exactly. Nobody would think of it as abnormal.
Did they check your baseline insulin and your HOMA scores?
Yes, that my fasting insulin was way up.
Oh,
and so that was the one thing nobody had ever checked. Neither had I, because I was exercising, I was sleeping well. It just didn't come as a thing on my radar.
Right.
It is now, of course, and it is something I monitor regularly. And I employ other types of dietary change. I do intermittent fasting. Okay. And I do work on making sure that if I can fast for longer, I will, because it's actually beneficial to challenge that system in regulation and production. It's for your body. Is the best way to describe it. And resets part of your metabolic rate, but it also improves that insulin sensitivity. So I was somewhat insulin resistant, bottom line, and where that weight gain came from. And so you want to look at, as a person listening to this podcast, you may want to look at additional testing from someone like yourself, Dr. Asamoah, who can order these tests and understands the meaning of what these trends in insulin, fasting glucose, A1C, interleukin-6, what these trends mean from not just a metabolic perspective, but an inflammatory perspective.
Absolutely.
So you could say that I had early metabolic disease.
Yep.
And I think that is what promoted some of my dysplasia to cause my colorectal cancer. Mm-hmm. And so I think that, you can do a lot of things. I'm a case of perhaps this would have come earlier if I didn't have the lifestyle factors in place.
Absolutely.
We can't, that's hindsight. We don't know.
Yeah.
There's no study. But at the same time, this is one of those points where I want to encourage people to say that if you think you might be at risk, you can delay it to a point where it is detected earlier enough when and I was detected at age 45, because that's the age that you're supposed to go get a colonoscopy. So it's like, okay, it's my time for screening. Here I go, kind of thing.
Yeah.
But, they didn't find my colorectal cancer with MRI. They found it with CT, but the original process was just the screening colonoscopy. And, the who did this was as surprised as anybody, because he didn't understand even how this could be in my body. He was shocked, just floored. He was in tears explaining this to my husband. It was tough, and he just didn't imagine that, he said, you're as healthy as my who run. And, this doesn't make any sense. And of course, I was still recovering from the sedative that they give you, but I don't remember the entire conversation. But at the same time, it's being diagnosed it really turns your world sideways for a while.
Of cancer, absolutely.
Which leads me to the other modifiable factor, and that has to do with stress management.
Right.
We have a ton of stress in our lives, and I know that for myself personally, moving away from the USA helped my stress level. I think it was because I was doom scrolling with the news and all the other things going on.
All the feeds that come through, right? And that's the news, that's social media, that's what you're reading everywhere. Absolutely. I agree 100%.
And as doctors, we're naturally empathetic people. And so I think to some instances, those feeds are a negative impact on our health. And we need to create a healthy boundary around when we can look at those and for how long.
Yeah. And
we set a limit and we don't do it again until the next day when it's time to look at that. And we can choose. Do I want to see this right now or not? And then we can choose what we expose ourselves to, because that sort of stress long-term is another source of problems. Stress creates inflammation. Emotional stress and mental health are one of the big things that came out because of the COVID pandemic. But we've already known that stress and poor lifestyle and poor sleep and no exercise, it all adds up to a largely inflamed body, or large, predisposition towards inflammatory conditions.
And I want to add to that, Dr. Kussman, the stress from the feeds that's coming out, but then there's also, whenever we talk to our functional medicine patients and we're doing our intake, and very often we'll realize that there was a significant stress, either a family stressor or a work-related stressor. I got divorced, or, I lost my child, or I lost my job. Right. And that very often is a trigger to some kind of major health event that occurs. So it's the things from outside, but also think about your internal environment and the stressors you're getting from a difficult relationship or, difficult work environment. And that plays a big role too. Those are all things that you have to factor in, right?
Yes. Okay. And I encourage anyone who is in any of those imbalances, I'll say, who's experiencing that imbalance, to find help, because there is help. Yeah. And there are ways to address these things. You don't have to do this alone. Some people like to try and sort out solutions on their own and Google this and that, and that's okay. That will get you so far. But at some point you may need more work or more advice or more detail. And so this is where people who, like yourself in functional medicine, can address those pieces that might be missing or that need further completion. So absolutely, everybody can do the basics.
And that's what we're sharing today. At least start there. I know you have a lot to share in terms of the role of environmental factors. We've talked about pesticides a little bit, right? I'm sure that most people think of the common things being like, oh, stop smoking, stop drinking, Tell us how those environmental factors also affect cancer risks.
So smoking has been long known, and we've all been informed by the Surgeon General that smoking kills, and it is the number one cause of lung cancer. And then secondhand smoke that is unfiltered is actually more carcinogenic. And so we have children and spouses or other family members who are exposed to this secondhand smoke who develop lung cancer as well, or asthma, or other types of respiratory disease that is primarily caused from the inflammation from cigarette smoke inhalation. Cigarette smoke sets off a number of pathways having to do with the carcinogenic effect. So if I can break it down, you have different signaling. They're now targetable. So I'll pick KRAS, for example. KRAS is something that becomes mutated in lung cancer and goes on to promote lung cancer. Kind of like that P53 that I was talking about earlier. It was just discovered later. And when KRAS is mutated, they've now found that you can target this. And in the recent studies that show that targeting KRAS produces a benefit. It's just not as much as they'd hoped, but it's a start. They will build more upon that foundation. But cigarette smoke directly affects your body's ability to keep KRAS unmutated. Because what I'm trying to say is you're causing DNA repair that cannot be fixed. Sorry, DNA errors.
Errors. Yeah,
that cannot be fixed by your body when you smoke cigarettes. And so you have to think of it as little deposits of damage every time. And it has a cumulative effect over one's lifetime. If you stop smoking, which we highly encourage, there's a ton of resources. There's help every day that can help you with that. It takes about 5 and then 10 and about maybe 15 years. I can't remember if it's 10 or 15, whereby your lung health returns to baseline before smoking. I do believe it is related to the number of years and how much you have smoked, but it is around the 10-year mark that after smoking cessation, at the 10-year mark, your lungs return back to their normal state of health that they were in before you started smoking.
which is huge.
Now,
which means
it's a big deal.
It's a big deal. There is definitely chance of recovery, going back to baseline and minimizing the risks of developing cancer if you haven't already got it. So,
yeah. And you can do more. You can stop smoking and you can start exercising.
Mm-hmm.
You can start doing a number of things that are beneficial to turn that back even more. Right. So you can leverage your anti-cancer effects when you stop smoking by choosing the things that improve your chances of not developing cancer. So that might be reducing risk altogether or delaying the onset. Again, delaying onset is better than getting it early. And so, we have to use these tools on the whole body to create a whole body effect.
Absolutely. That's great. Any other environmental factors? What is the data on alcohol?
So alcohol does have an effect. There's conflicting advice with red wine and resveratrol, because resveratrol in breast cancer actually shows a beneficial link. And so they were saying that if you have breast cancer, 1 glass of red wine is not a harmful thing.
A day.
I think that in moderation, the things that you want to keep in mind have to do with your own metabolic state. Mm-hmm. So if you have insulin resistance, any alcohol in any form is bad for you because your body cannot process the sugars from that alcohol.
Absolutely. Yeah.
You will not break that down, and it will contribute towards more inflammation. Mm-hmm. So if you're unsure, go get checked. Figure out what your insulin levels are. Find out if you are insulin resistant, because that's kind of one of the triggers that adds the weight towards developing metabolic disease. If you don't have metabolic disease, you don't have insulin resistance, you exercise, you eat healthy, I don't think that alcohol in moderation is an issue. And when I'm saying moderation, I'm saying 1 out of every 7 days. I'm really a moderate enforcer of that. And it has to be something with antioxidants or zero glucose influence. So if you're going to have red wine, it has to be a dry red wine, not a sweet one. If you're going to have any type of spirits over things like beer or white wine, they actually have a lower glycemic index. And so as a result, you're better off having something that's made from a botanical, and I'm going to get into it here, gin or tequila. Right. Gin is made from juniper. Tequila is made from agave. Both have healthy properties in moderation. So those are some options. But again, it's once a week. It's not every night. I don't recommend that at all. I don't think those are appropriate for hepatic health. Alcohol interferes with a number of the ways that different drugs are metabolized. And so I also think that it causes some liver inflammation. If you're taking metformin, alcohol will mess you up. So you can't
take it at all.
At all. It really causes a problem. And anybody with insulin resistance may be taking something like metformin. And so again, something to keep in mind in that if they're incompatible, you will end up with vomiting and feeling horrible.
I wish more people knew this, because a lot of people are on metformin, and I see a lot of people in clinic, and they're like, most have metabolic fatty liver disease, and I can tell they're mixing alcohol, right? And they're like, I feel so nauseous and my tummy hurts and I feel sick. And I was like, well, you're drinking and taking metformin, and there's direct interaction there.
So you kind of need to go through, okay, what am I on? What am I taking? And is this actually compatible? And usually it's not, unfortunately. And so you just need to be able to manage without, and it's very possible to manage without. So.
Oh, wow. Heidi, you are sharing so much great information. Honestly, I'm learning a ton, and I'm sure everyone's learning a lot as well. All right. So let's go into what did we want to discuss as well? We wanted to we've kind of talked about the immune system and inflammation as a driver for cancer, right? We've really talked about that. Let's go into preventive services, right?
So when it comes to prevention, we want to attend our screening first and foremost. The early detection guidelines are there for a reason, because they work. It is far easier to treat an early cancer or to prevent one in the case of the gut through polyp removal or identifying APC genes or different things that would predispose someone. In the case of colorectal cancer screening, doing things like your Cologuard test
Yes.
And if you still think that something's wrong, even though it says it's negative, get a colonoscopy. There's nothing wrong with doing a colonoscopy. The benefit outweighs the risk. That's the bottom line. If you think there's something going on, you need to get it checked out. And there's no such thing as a wasted test. I think that a lot of medical doctors have been chastised by insurance for over testing or, you know, the piece about this test isn't necessary. I remember that when I was pregnant with our daughter, and that they were like, we can't test for it. I can't remember what I'd asked about, but they were saying we have to wait a certain time frame before we can test this according to insurance guidelines. And so in the end, okay, fine, not a big deal. I didn't have any troubles with my pregnancy. But when it comes to things like screening, now that we're recognizing cancer is not just a broad cellular problem, but a metabolic driver of inflammation, we need to change how we test for it and look at those metabolic drivers of inflammation.
First, yeah.
So our testing panels need to change for cancer. It's no longer about just tumor marker testing. It's about looking at your metabolism. And your specific metabolism for one type of cancer could be different from the other. So your earlier detection guidelines in general for cancer have to do with looking at how you manage glucose and looking at metabolic syndrome specifically. Early onset diabetes or pre-diabetes is a prerequisite to cancer development. And so anybody with type 2 diabetes, which is a modifiable disease that can be worked back to a minimal weight or a minimally problematic issue in our lives through diet and exercise specifically, dietary change and adherence. It takes months, but it works. And monitoring your labs and things and trends towards what is going on in the metabolism that is affecting cellular repair. In general, the earlier you can detect abnormalities, the longer, the less chance you have of going down a path that only detects things after something is visible on imaging. And usually at that point, there's lymphovascular spread or there's something along the lines of, and in the gut, not so much, but in the case of like ovarian cancer, it's always metastasized before it's detected.
Before you detect it.
And so there's a number of preventative things that come into play before that though. I have ovarian cancer patients who didn't know they had metabolic syndrome. I have lymphoma patients who didn't know they were diabetic.
So now, you know, at some point, I think the patients are taking responsibility and being very proactive about their care.
Yes.
So someone listening to this today, if you go for a general wellness preventative checkup, blood work with your PCP, they're usually not checking as in depth as what we're discussing today.
Right.
You'll be lucky to get an HbA1c, which may look normal, right? They're not checking any of the IL-6 markers or tumor necrosis factor markers, nothing like that. They are not checking baseline insulin. So what are some of the key markers, typically, and all of these are generally insurance covered, that you would ask your primary care, that Heidi, you would recommend that people ask their primary care doctors to check?
So when you have a functional medicine doctor, they will do this for you.
Yes.
So that's the first thing. You need to find someone who's a functional medicine IFMCP certified doctor. And then from there, you will ask for, it's a long list. So I apologize. You will ask for, you're looking at glycogen management. So you're looking at your A1C, your fasting glucose, your fasting insulin. You're looking at interleukin 6, interleukin 8, CD4, CD8. Those are your T cell breakdown because you want to know what's going on with your your T cells, which are actively surveilling tumor DNA or cancer cells in the system, in your circulation and your lymphatics. You want to look at things related to the liver, LDH. Not just AST, ALT, and ALP.
Yes.
You need to look at what's going on with inflammation. And LDH is one of the things
I would
in the
say
liver.
LDH and GGT, because sometimes GGT is one
of the most overlooked labs.
Yes.
Because it points to inflammation faster with more sensitivity than the other lab markers.
Yep.
So if you can get GGT measured and it's elevated, you got to work on something. Something's going off and you have to fix it. This is not a little fire in the corner of the house. This is your kitchen on fire and you need to do something about it.
Absolutely.
because that level of inflammation in the liver is never good for the body. It might be a viral thing like hepatitis or another form of inflammation in the liver coming up as a result of a drug reaction or another virus for that matter. But you still need to test those.
And that
Other
should be
things,
tracked, right, over time.
yes,
Yes.
So, and these things should be tracked I would say every 6 months. It would be tight to say every 4 months unless someone was really motivated and making those changes and they weren't doing anything else. It's a project to change your sleep, start exercising, improve diet all at once. I tell people do this one thing per week. And if you feel like you didn't quite grasp that change, then give it another week and before you add on. Otherwise, you'll end up being overwhelmed at 3 weeks.
That's a really good strategy. That's a great strategy.
Yeah. You have to go at the pace your body is able to. So when you get baseline labs and you go, okay, I need to make changes, then you measure again when you feel like you've been able to adopt all of those changes and you have a good thing going in terms of routine and habit, then you can get those labs redone. I usually say every 6 months you repeat this panel.
Absolutely.
Because you want to assess what's going on. But not just blood work. I also look at stool function or stool studies to assess gut microbiome because we know that the gut has a lot of the lymphatic system around it. And this is where that immune system connection comes into play. When our gut is inflamed, our immune system is overtaxed. 70% of our immune system is around our gut for the reason that all our external pathogens usually come in through what we drink or what we eat.
What we eat, yes, absolutely.
It's bugs and germs on food that give us food poisoning or different things like that. And a healthy gut microbiome begins with proper food hygiene. And I do talk about this sometimes when I have people who have reflux or H. pylori superinfections, those types of things. But you want to screen for those as well. You want to assess for proper digestion before trying to fix the microbiome further down. If you don't have the right acid levels, you're not going to break down protein, which is then going to ferment in your gut and cause gas and bloating. Your gut microbiome is going to be affected by that. So you have to have optimal pH when you're eating. You have to chew your food. I know that sounds funny.
Chew, yes, it's very important.
But if you just take 3 bites and then swallow, your stomach doesn't have teeth. So there's things that are required at the different steps in gut health that we can influence. Slowing down and eating without watching TV or a movie. We see a lot of people who put the iPad in front of their kids when they eat meals, and the children eat as a result. And that might be a good strategy for the short term to help a child introduce new foods or whatever might be going on when it comes to that stage and age. But I don't believe it's a long-term solution. We need to be aware of what we're eating. We need to have gratitude, look at our food.
Mindful eating, appreciate it, appreciate the look on the plate, appreciate the taste in the mouth, appreciate the response of our gut towards it. Absolutely.
Yeah.
Absolutely.
If we eat without that mindfulness, then our body doesn't really understand what's going on. Our autonomic system doesn't kick in towards resting and digesting. It's still our sympathetic drive that is towards elevated heart rate, not paying attention to what our body needs. And so the end result is when your digestion is in optimal condition, and you can test lots of different ways for gut function. Stool studies are one. You can do urea tests and breath tests and different ways for assessing. You can do upper endoscopies, lower GI endoscopies. Those are all very important in assessing the gut health. And I encourage people to do those things. If nothing else, it would be to establish that, okay, it is just metabolic issues to work on. Right. Because if you work on metabolic issues based on the labs, yet you have something going on in the gut and you've done all this work and nothing's changed, how unrewarding is that? You're working hard. This should be something that is assessed all at once and then reassessed so that you can see where the trends are.
And I like what you're saying, Dr. Kussman, because that's exactly what we practice, sort of integrating both, right? Working on everything that's integrative and functional, and then also using all the tools, all the positives of conventional medicine, all the diagnostic testing that we have available to us. And so why would somebody decide? So I'm sure that you get a lot of patients coming to you who are certainly maybe angry at conventional medicine, really upset that they've been failed by many doctors. They didn't identify things quickly enough and don't want to get any kind of invasive or even conventional medicine testing done. And how do you talk to them? How do you guide them in terms of preventative testing, right? What do you say?
I think it has to do with the fit. They haven't had a good experience because they haven't had a good fit with someone who is like-minded. Now, before COVID, it was a lot harder to reach out and find someone who matched your needs as a patient. But I think that COVID has created an opportunity for people to reach out and find other providers through tools like telemedicine or the emergency measures that were taken in place to allow people to come out of retirement and practice or practice across state lines, different things like that.
Yes.
And different organizations came up as advocacy groups as well for different disease states. And so I think that, for example, if you have Crohn's and you know you have a risk of colon cancer as a result, you're getting nowhere with your primary care physician or your gastroenterologist who simply, by no fault of their own, hasn't the interest or the time or the training or is busy enough or maybe burnt out. And there's lots of personal factors that go on in everybody's lives that contribute to why they are or aren't doing something. And I think it's important to give them space and to forgive them and to be able to say, I can't hold my doctor responsible for everything. And if I'm not a good match with my doctor, I need to do this. And for my own benefit, I can't wait for my doctor to do it for me. Yes. They're busy enough. They're people too. And I think that we need to be able to respect each other as patients and as doctors across professions and all the different parts of our lives to say, okay, I acknowledge this might not be working for me, but I don't need to get mad at you about it.
Right.
I need to be able to find a solution for it that keeps me open to receiving the best care that I can get in the system that I'm working with. And I encourage my patients to be proactive consumers, but also if they don't know what questions to ask, to get on some patient advocacy groups, forums, there's a ton of them, some of them not so good.
So many.
I don't really recommend a lot of Facebook forums for my patients who in oncology. There's a lot of fear and a lot of anger. Yeah. And I usually say, stay away from that stuff because it's kind of like the toxic news feed.
Right.
You really don't want to get down that rabbit hole. Yeah. You want someone who can help keep you in your corner, keep you focused on even though you had a bad scan, this is what we've got coming up. These are the things we're going to keep working on. And if you're in remission, you don't leave that group. You keep encouraging other people because we are here to help each other. Mm-hmm. And so if you have a patient who comes to you saying, oh, I tried that, nothing worked, or I've been there, done that, nothing worked. Mm-hmm. You have to explore with them where the block is coming because they may not understand what you can do. Mm-hmm. And they may have been there and done that, but not in the right format or order or in the way that it should have been interpreted in terms of the result or whatever it is that did not work.
Right.
I think it's important for patients to keep trying. They cannot give up. They have to keep trying to find the right person for them because when they do, it's like a lock and a key and you have a partner in your healthcare for life.
Yep. It works. Yeah.
Yeah. And I think that there's more than enough patients to go around for that. And there's more than enough types of professionals, of physicians who are able to match those patients' needs. We just don't do a good job of finding them. We have a lot of sort of gatekeepers in the way, one of them being insurance and how insurance is
a huge one being insurance. Yes, absolutely. Yeah.
And so
even in terms of the gatekeepers, I feel, we're going even beyond our topic now, but I think just like you said, patients have to keep trying and also understand the value of finding that person or finding that resource, right? Because I feel like insurance not only blocks providers, but it also blocks patients in who they have access to and who they can see. And some people are so stuck on, I have this insurance and this is what I can use, and don't want to look at other options or alternatives, which could be life-changing, health-changing for them.
Yeah. They don't realize that could be a limiting factor.
A big limiting factor. Absolutely.
And so insurance is a bit of a rate limiting step when it comes to access and finding the right person.
Yes.
But I think that there are people out there who can still help. And I think it is important to not give up And then one thing I want to say in my profession in naturopathic medicine, I'm one of the rarities, you could say, as a naturopathic doctor who went and did her screening at the right ages and was, following the guidelines. Mm-hmm. And I don't know if it's because I work in oncology or because I'm a more conventional naturopathic doctor. If you should think of it on the spectrum of like the far way out there, right. And then the more sort of everybody has their strengths and everybody has patients who fit in that spectrum. Yeah. But I'm definitely, I know I fit into the more conventional side of naturopathic medicine. I use data, I use evidence every day in making decisions for my patients when I'm consulting with them about their treatment options and second opinions. I'm not pulling this stuff out of a hat.
Right.
And so this stuff is what I do. And so as a result, I think it's guided me in going and getting my screenings. Mm. One of the things that I heard when I shared with my naturopathic community that I had been diagnosed was jokes about colonoscopy, really unprofessional. Really? I set them straight because I was like, look, you're a role model for helping patients. This is an issue. If you yourself don't want to get a colonoscopy, that's fine. But for whatever reason, you need to hold that personal opinion, out of the office. Yes. You're doing your patients a disservice. It's a liability. There's a number of things. And then, and there were other people who were like, I wish my wife had done this. She was convinced of XYZ would work instead of getting the proper diagnosis. Yeah. And so sometimes a second opinion is important in those cases. Mm-hmm. A belief system can really be detrimental in some cases as well. And so when it comes to your health, it is most important to be open-minded. And there's a spectrum. You can employ all sorts of things in prevention, which may work if there's evidence behind it showing that it does work in human studies. Mm-hmm. So the bottom line is every patient has to keep working at finding the right fit, and every physician needs to listen to what their patients are asking for and perhaps find a way for one of them in their busy day. Maybe it be through a referral. Maybe it be through, I'm going to try through insurance to order a fasting insulin and see where that takes us. Just the simple step of trying on both sides matters, because if you can meet somewhere in the middle and find common ground and go from there to developing a more trusting relationship and an open one that is based on open communication, you can actually create huge impact in patients for their long-term health, because it motivates them to make those lifestyle changes. Because lifestyle change is not easy. You can't just give it to them like a homework assignment. It is a lifestyle. It is, yeah. You have to be able to support them. And not everybody can get this all done on their own. They need follow-up and they need coaching and they need support and advocacy. And so it's not just a simple thing. It's a 3-dimensional change that is required. And I think that when patients are frustrated, it's okay. It happens and it's normal, but it's also important to keep moving, not to be stuck and give up.
I like that. That's so important, especially when you are aware of risk factors for cancer development. When there's the genetics, that my parents had this or my grandfather had this diagnosis. And, you're trying to do everything that is possible to avoid this diagnosis. And
you're approaching it from a place of empowerment. That's the other piece. I want people to feel empowered and not fearful. I think that fear is largely a negative emotion, and we need to flip that into a place where we can do something about it every day. And some days, like I say, are better than others, and that is completely normal. But the piece of controlling and using our fear to harness our motivation might be a process that we can all work on, of course, in different aspects of our lives. But when it comes to preventing illness, if you saw family members go through cancer treatment or had been diagnosed with a chronic disease that was debilitating, that is not a good experience to go through. I don't want anybody to go through it, but at the same time, it is something that we can use as a learning experience, as a humbling learning experience to say, okay, in my family, these are the things that happen. This is what I have for my toolbox in terms of how I can mitigate it, how I can delay it, how I can prevent it. And this is what I can do. I have all these tools. I'm going to choose this, and this with the help of these people behind me, like a team or, all these people, they got their hand on your back, that sort of thing. they're not sort of in a line. They're beside you. And you're all working towards this as a team.
Yeah. Heidi, this has been such an amazing conversation. And thank you for sharing your personal journey as well, sort of like personally and professionally, and just bringing that all together. I think you are such an amazing example to a lot of physicians, naturopath and conventional alike. I really love learning from you, learning about how you integrate and really use evidence-based medicine to help treat your patients, because I think that's really important. Now, I know you're in Abu Dhabi.
Yes.
Wanted to reach out to you. What was the best way?
So I don't have the ability to take phone calls, but I have my email address on my website and I answer emails regularly. I'm always checking. And for people who choose to become patients, my patient portal software allows people to message me directly. And so it's HIPAA compliant, which is way better than email. So emails are, what I encourage people are using to contact me, to gather an idea about my practice. And if it's a good fit for them, I do offer, a short, free 15-minute dialogue to discuss, how I practice and how often I see you and the different things that are implicating our treatment and the schedule and testing and so on, just to give patients an idea, because I don't take insurance. And so all of this is out-of-pocket cash payment. Sometimes I can issue papers and forms for people to try to claim from insurance some form of reimbursement, but there's no guarantee. And so, even though I have an NPI number, there's still sometimes issues with that. So I don't guarantee anything covered by insurance, but it's just the way. But yeah, my website is the best place. It's integrativecancersupport.com. And I'd be happy to help people or answer their questions, or even just refer them back to someone I know in their home state or province or wherever they are in the world that I know of in my network who could also still help them. They just may not be aware of them.
Yes, that's awesome. We're going to post that website as well as a little bit of information about your bio online when we are done with this live. But this has been a wonderful conversation. I feel like we need a part 2 because there's so much research in terms of fecal microbiota transplant and the response.
I didn't even get into talking about the dark matter. The plasticity of the tumor microenvironment. Like there's a ton, but I don't want to overwhelm either.
Yes.
Another time, part 2.
We'll plan for another time. We'll plan for kind of like a part 2 when you have the diagnosis and post chemo and post immunotherapy and that recovery phase. So I think I look forward to hearing everything you have to say. There's so much information coming out.
I'm happy to share.
Thank you so much, Heidi. This has been wonderful. And I bet we're going to have a lot of questions. We're going to have a lot of great engagement from this post, but I really look forward to it. This was an important one. Thank you for sharing.
Thank you.
All right.
It's been my pleasure.
Bye, Heidi.
Bye-bye.